the therapist. I'm not as my patient. I'm going to ask him 3 history questions. Are you having any trouble performing daily tasks like bathing or dressing?
Yes.
Okay. Did you fall or land on your hand incorrectly?
No.
Okay. Do you have a history of rheumatoid arthritis?
No.
Okay. All right. So I am going to pick brachialis for my manual muscle test. That's my first muscle I'm going to test. So he can be sitting or standing. Go on my side again. So I'm going to ask him to put his palm down towards the ground. I'm going to ask him to flex his hand up to his shoulder and back down. So he's a grade 3. So for the brachialis, he's going to come back up to neutral. And I'm going to provide resistance on his forearm. And I'm going to palpate behind under his bicep. That's one. And for baby,
Don't let me move you. Did you do that?
Don't let me move you. It's okay, you did it.
Okay,
yeah.
Cool.
So for brachial radialis, he's going to be in a neutral thumb up position. Again, arm by his side. He's going to move his arm up to his shoulder and back down. So he would be a grade 3. So he's going to go back up to mid-range. I'm going to put stability on his elbow, and I'm going to provide resistance on his forearm. I'm going to tell him, don't let me move you down, and I'm going to palpate in here. That's those 2 manual muscle tests. So for the goniometry, elbow flexion. Okay, so for elbow flexion, I'll move to this side so you guys can see. So for elbow flexion, I am going to put my fulcrum.
For the lab practical, how are you going to position him?
Oh, for the lab practical, I'm going to position him in supine. So I'm going to find his lateral epicondylitis for my fulcrum. My stabilizing arm is going to be with his humerus, and this arm is going to be with the radius. And I'm going to ask him to flex his arm all the way, and I'm going to passively rotate him all the way up. And he is at 130. So that's elbow flexion. And then shoulder flexion. So I'm going to find the lateral humeral joint. I'm going to put my fulcrum there. So here's his AC. Lateral humeral is here. So I'm going to put the stabilizing arm with the inline of his trunk. And I'm going to ask him to flex his arm all the way up passively. And try to realign. And my arm is going to be with the humerus and midline of the trunk. So he is at 160. And so for my sensation test, I'm going to do the axillary nerve. I'm going to ask my patient to close his eyes. When I tap you, say yes.
Yes. Yes. Yes. Yes.
Okay, so his sensation seems fine. And for my specialty test, I'm going to do the speeds. So I'm going to ask him to raise his arm up. And I'm going to ask him not to let me push him down. And I'm going to do a fast, quick motion. And then speeds.
Okay.
And that's everything.
Palpation.
Palpation. What am I palpating?
Bicipital groove.
Bicipital groove, right. So I'm going to put my hands on the anterior side of his humerus. I'm going to find kind of like where the head of that
Greater, lesser
tubercle. So I'm going to palpate here, and I'm going to ask him to externally and internally rotate. And I'm palpating in here. feeling where those two heads are moving.